Well, I got involved in healthcare because at a very young age, my mother persuaded me that I needed to be a doctor. And I think that was inculcated into my brain for so long that I really believed myself I wanted to be a doctor. But I didn't know what being a doctor might mean. And I didn't realise that until I'd gone to medical school and qualified. And indeed, in medical school, I enjoyed the course I did because it was very intellectually stimulating. But then I realised I didn't want to do that. So I came back to Merthyr Tydfil, where I did general practice. And I discovered within the first week of general practice that all my wonderful knowledge that I gained in a centre of excellence was not much use because the people were presenting with problems that really weren't organic ones, but were problems that were, we use the term now, psychological and social, psychosocial, and particularly social ones. So I became very interested then in probing into that area. Earlier, I had been involved in the Aberfan disaster because I was, by pure chance, I'd come home on that very day. I was only a final year medical student, and I was involved for about 48 hours. And that also made me feel that I had a commitment to the community, and also that the problems of depression and failure to cope were not just organic ones again, but the results of such terrible trauma, that bereavement that was expected. So it changed my life coming to Merthyr again in engaging with people who I knew well, and I wanted to do something with it. So that's why I got involved in the NHS. What is the NHS, and why do I value it so much? It's because I do a lot of travelling. I'm very fortunate to be asked to go and give talks here, there, and everywhere. And I go as widely different places as Namibia and Oman to New Zealand and Australia, which are much more kin to us. And even though I admire what I see out in very oil-rich countries like Oman and in very Anglo-Celtic countries like Australia and New Zealand, when I come back home, I realise what I'm missing. I think the National Health Service, despite its blemishes and warts, which we've got to attend to, is the jewel in the crown. And then when you look at the advantages that we have under the system, it is still comprehensive, it is still universal, it is still free at the point of access. And we must never lose that. And I would die in a ditch to preserve that. So despite the blemishes, despite the warts, we've still got a system that is admirable, a system that meets the great majority of people's needs and is not now just focusing upon those romantic, let's do better operations, let's say how scientifically good we are. We're now moving towards, let's look at what the needs of the people are. Let's look at not just healthcare, but let's look at what are the factors that predisposed to a good life and a healthier and a happier life. And they are, 80% of that is not healthcare, it's transport, it's education, it's all the other factors. And being in public health, I feel that I have a commitment to improve the health of the people of Wales with my colleagues, but not solely by functioning on the healthcare. The NHS is greater than just being a deliverer of healthcare. I see the National Health Service changing to be more focused on treating chronic disease, eliminating chronic disease, and and I hope for this, but not many people are doing it, but they all talk about it. They say, we must have more effective prevention, but you don't see that happening. I'd say this about Public Health Wales, we've been probably saying that for several years as well, but not doing anything about it. But at last we're doing something about it, in that we are now looking at bringing all those different people together that affect a person's health in a country, and actually working together, pooling our resources, pooling our money, and actually saying, what is it that we need to tackle in the new era, which will have the biggest bang for the buck? And we say it's the first 1,000 days of life, and that's from the first day of conception to 1,000 days after that. Surprisingly, yes. If you ask people who've been into hospital, what their experience has, 90% say it was excellent or it was very good. Now, I don't think that's just because they've got a sort of halo effect after they come out of hospital. It's because when you actually experience the NHS at its best, and often it is at its best, and see the commitment of people within the NHS, the public think, quite rightly says, my goodness, they appreciate what's done.